Hello and welcome to Mouth Matters, the world's first podcast dedicated to all things oral healthcare. I am your host, Hudson Hector, a dentist and hygienist.
And I'm Jennifer Mitchell, a registered dental hygienist with a passion for making people smile.
Each week, we'll dive into fascinating topics, expert advice, and practical tips to help you achieve and maintain a healthy and beautiful smile.
So sit back, relax, and let's get ready to explore the wonderful world of oral health together.
Welcome, everyone, to Mouth Matters podcast. I'm so excited with that first episode of Mouth Matters. I am your host, Hudson Hector, and I have my co host with me, Jennifer Mitchell, who's going to
Hi!
start that. Awesome, awesome. I welcome everyone, our audience, wherever you are listening to us in your car, at home, and we welcome you in that first episode. Jennifer, can you tell the audience about you?
Hi, everybody. My name's Jennifer. I'm a registered dental hygienist. I have been a hygienist for about 4 years now. And prior to becoming a dental hygienist, I was a dental assistant for about 10 years. So I've been in the field for quite a long time. I'm really excited about being on the podcast with you, Hudson. I have a huge passion for dentistry and dental education. I've worked in several different states throughout my career, and I'm just excited to get the word out there and promote good oral health with you.
Thank you, Jennifer. I'm so excited in that you accept the offer to be my co-host.
Of
And
course. Thank you for having me.
no, my pleasure, my pleasure. And I'm sure the audience will have a blast with you, and we're going to have some fun, dentally
Definitely.
fun, some
Yeah,
dental fun. Awesome,
okay.
awesome.
So introduce yourself. Tell the audience a little bit about yourself, Hudson.
My name is Hudson Hector, and I often refer myself to, for my patient to remember my name has Hudson River, and in New York, Hudson River, Hudson Valley, or Hudson Bank. Easy to remember. I've been in the field of dentistry for over 23 years. I started very young. Uh, I am a hygienist. I'm a dentist. I've seen it in the profession. I've did different fellowship, and I've pretty much I work mostly in Connecticut and New York. I've traveled the world, many places in the world to give good care. I went to Africa, in the Caribbean, in Europe, different places. And I'm excited to bring a wealth of knowledge and experience in the show to share with you, Jennifer. I know you are full with experience to my audience. And as well, I've taught a dental assistant. I've been there. I've been in the block in this field. And I'm excited to share a lot with my audience.
Yeah, me too. Also, another thing, when we were talking about this the other night that you mentioned, you said one of the main reasons why you wanted to start the podcast is to spread knowledge, and that knowledge is power. Can you talk a little bit about that?
Yes, definitely. The main reason I start the show it's because I have seen a lot of thousand thousand of patients during my time in dentistry in different places, and I can say the problem I realize a lot of patients are not aware, they are not fully educated about the mouth. The mouth itself, it's not about teeth. When you think about people's teeth, it's deeper than that. We need teeth to masticate, to speak clearly, but we need the mouth because it's a part of the body. I always say the mouth is the gate of the body. And personally, a lot of disease of the body, I can see it before any physician can see it in the
Yeah,
mouth. All the signs are in the mouth, in the tongue, and different part of the mouth. That's why I'm quite excited to share that knowledge. I want my audience, I want my patient, as well as your patient, and not only here in America because we're going to syndicate that show internationally as well, that people can know in a way they can be well informed when making decision about oral health. It's not dental or oral hygiene only, it's about oral health. And why is it important for people to take care of their mouth, not only of the teeth for gum disease or for cavities? It's deeper than that.
Right.
That's where we're going to go in diving. And I'm so excited that we're going to have different guests in the show. We're going to have a
Yeah.
surgeon, we're going to have an endodontist, we're going to have orthodontist, we're going to have physician, we're going to have oncologists,
Nurses.
even nurses, physician assistant, gynecologist, because the mouth, like I said, it's the
You say
first part, is the
gynecologist.
gate. Even gynecologists, because if I have a little bit about that, if someone their mouth is not clean, like someone is pregnant, they can have like a low
Mhm.
stillbirth kid
Yep.
because of the bacteria that can live in the body. That's another subject completely, and I
Right.
cannot wait to dive into that
Yeah.
about the good bacteria, bad bacteria. Oh man, I'm so excited and I cannot wait. I
Me
cannot
too.
wait. And it's exciting, people. It's really exciting. I'm really excited to start
Yeah,
that podcast, and there's many things to come. And
definitely.
what is your point of view about like educating your patient? I know you've been in the field a lot. What do you see as knowledge of? I don't want to say lack of knowledge. What do you think information that the patient needs?
Yeah, so I feel like working with patients, there are a lot of people out there who just aren't aware of their mouths or just their general bodies. I've seen patients where they've had a broken tooth and they didn't even know it was broken. I would immediately notice. So I really push patients to be accountable to themselves, take responsibility for themselves, and really become aware of their bodies, their minds, and just really be aware of what's going on with them. And I feel like the mouth, it's out of sight, out of mind. But you said something really interesting. There's a saying that says the eyes are the window to your soul, where, well, your mouth is the window to your total body. Um,
Exactly the gate.
yeah, and a lot of systemic disease does manifest in the mouth
Yes,
first, or
100%.
and we can use a lot of those oral findings to determine other things wrong in the body. So that's why I really push the patients to really be aware of what's going on in there. It's kind of like the first alarm to how you're feeling totally. And I just want to get patients more available knowledge. I have a lot of information in my head. I know you have a lot of
And
information in your head. I want to get it out and get it into the patient's head, the
definitely.
average person. And also, not just the average person, but also dental professionals. Being a medical professional, things change every day. We need to discuss new findings. We need to discuss new techniques, push each other to really help our patients. So I'm all for education all the way around, full circle.
Yes, definitely. To go back to what we're talking, you mentioned a little bit that when we talk about systemic disease, a lot of things, for example, lupus, we are pretty much the
Lupus.
first person that can see it.
Mhm.
And you have like diabetic, we can see that.
Mhm.
I
Mhm.
remember a couple years ago, I have a patient that have a metastatic cancer tumor in the jaw.
Uh-huh. A metastatic
And
tumor in the
yeah,
jaw. Mhm.
and the patient did not want to take a panorex.
Mhm.
And then I convinced the patient that is very important, they never have it. And when we take it, boom, the tumor was there. And
Right.
I told the patient, you need to get that checked.
Yeah.
And the patient didn't even do any like normal tests, our patient to check that. And then they went to the doctor. And guess what happened?
What?
It's they had breast cancer
Yep.
that started in that metastase in the mouth. And it's very evident a lot of things happen. Like for me, very often I can say 98% of the time I try to do something that called intra and extra or examination for my
Mhm.
patients.
Yep.
And hopefully a lot of providers do that. And I have a patient. I remember I was doing a rotation in one of the hospital, and I did a EOIO for those patients. The EOIO mean EO mean intraoral, and EO mean extra or examination.
Right.
And when I pipe the lymph node, boom, something was weird. I can feel the ganglion. And then exactly perfectly. All over here, the neck, the occipital region, the neck, exactly. But definitely the muscle and all of that. It's not only massage, it's feel good as a massage too.
Right. Yeah.
Not to be wrong with that. And we detect that I send that patient to see her physician, her PCP, primary care physician.
Uh-huh.
Just say, no, you don't have any problem. And the patient said, the way this gentleman told me
Yeah.
that I should get it checked, I need to see someone else. And then she went to see another doctor,
Yep.
and
A second
boom, it
opinion.
was there.
Right.
And then the doctor said, this person saved your life
Right.
because it was a tumor that developing. I'm telling you, guys, there is a lot of information, and I cannot wait to go dive
Yes.
into those information.
Yeah. I can't wait to get the information out of my brain and out into the world. I'm super excited.
For me, there's a lot of information. I'm saying, man, how I'm going to get all of those out.
I,
Anyway, thanks God is a podcast. We have like a lifetime to
yeah.
get this thing out. To get
It's-
this thing out. And if we go a little bit further, it's not only brushing, flossing that is very important. Brushing, flossing, the way you brush, the way you floss. I'm sure in our next step, we're going to, Jennifer, going to show you guys or to indicate how to brush because there are different technique how you can brush. That is
Mhm.
very important. That the basic of oral hygiene that can save you years of trouble, and that can save your teeth until you turn 120 years
Right.
old. That's what I said to my patient. Pretty much. No,
Yeah.
there's more than that than the mouth. It's not only teeth, it's more, it's the gum, it's the
Tongue,
it, the tongue is
your lips,
exactly. It's a
your throat,
whole thing.
the whole thing.
Exactly. The whole thing is the whole mouth.
The whole thing. A lot of patients think it's just teeth. It's just teeth. I'm like, no, we got to look at everything.
No, it's more
Everything.
than teeth.
More than teeth. I too do an EOIO and an extraoral and intraoral exam, and I feel all over their lips and their face. I grab their tongue. I feel their cheek, and they're like, "What are you doing to me?" I'm like, "I'm getting in there. We got to feel around in there. It's more than just teeth."
Yes, definitely. I during my tenure, like cancer or cancer of the tongue, the lateral border of the tongue. There's a lot of stuff that people should be aware of,
Hmm.
and we will be educating our audience about that. You're going to be yourself. You're a mini doctor for yourself,
Right.
because no one know yourself better than you. You need
Correct.
yourself, you need your mouth, you need your body. And if you don't have a good mouth, not teeth, you will not be able to eat properly. If you cannot eat properly, that is a problem. Your nutrition, your diet, all the stuff will be a problem.
It is
It's connected to
domino.
your gut, to your stomach, your digestion, and we are a whole. It's not like, oh, it's my head, it's my arm. You cannot say, I don't need my arm, I don't need my teeth. That's really hurt me when someone come to the practice. I want my teeth out and I want dentures. That's another topic completely that we will be we will
Right.
cover.
We'll
Uh,
discuss it.
yeah, we'll discuss that. It's like, take that tooth out. I don't need it anymore. It's bothering me too much." No, if you can change, if you can repair that, you can fix those teeth and keep them. That's what
That's the
we should
best.
be doing. That's the best way to go.
The
That's the
best.
best way to go.
Yes.
Pretty much, that's the main reason I wanted to start this podcast. And
Yes.
I'm sure this podcast will turn into something even bigger, where more people will be able to watch
Right.
what will be demonstrating for you to take better care of the mouth.
Yeah.
That's one of the reason I chose that name, Mouth Matters, because it really does.
It does
It,
matter. It's
it
very important.
it's very important. It's
Super
very important.
important.
Definitely,
I
definitely.
agree. Okay, very good. So let's move on to oral hygiene basics. There are a lot of different products and tools and things out there to make sure to ensure that you are taking good care of your mouth. But we're going to start at the basics. We're going to start at step number one. Later on in other episodes, we're going to add more things on. But right now, we're starting at a basic level of things that everyone should have in their bathroom to make sure that they are cleaning properly.
Exactly, exactly.
And
And and one of the things I can say that people need in their, for their routine, then or with a routine care,
mhm,
having a soft toothbrush.
yes, toothbrush.
Yes, not
I
not a toothbrush that you can clean your pot.
correct. No, no, I always say no medium bristle, no hard bristle. Soft or ultra soft.
Yes,
Um, a lot of people don't realize having a medium or hard bristle toothbrush can actually damage your enamel, your tooth structure, and your gums. You literally can just brush away your teeth and gums. I've seen it.
definitely. And if I go like Jennifer said enamel, what is enamel? Enamel is the
Enamel.
part that you see and your mouth, like the crown on what you see Jennifer how like that is white, what you see that cover the tooth that help you to bite, that hard substance fruit minerals
Yep.
that cover your tooth, that's the enamel. It can be white, it can look a little bit yellow. We don't want it to be
Right.
dark, we don't want it to look like charcoal. We want it to be a little bit yellowish
Right.
and white.
Correct. White. So yeah, the enamel is like the hard hat on the tooth that protects the tooth. And it also slows down the cavity process and it prevents stimuli like hot, cold, and sweet things from getting in the tooth and causing nerve pain, sensitivity. So we want to protect that enamel. We want to protect the gum. So toothbrush, basic,
Yes,
you get some type of toothbrush. I don't care what, if you like an Oral-B toothbrush, a Crest toothbrush, I don't care what the brand is, just get a toothbrush that is soft or ultra soft bristles.
definitely. And it can be different, like you say, it can be like electric toothbrush, it can be manual toothbrush.
Right.
A lot of time I prefer the electric toothbrush for some of my patients because for dexterity, the person can have like some mobility problem, or even that the person can have some dexterity, but because it's rotate faster more than the manual toothbrush, it's depending on the case, electric toothbrush can be good.
Yeah, it's more
And yes, it's more efficient, and it should be replaced at least every 2 months or 3 months. And
the
make
head,
sure you take it, yeah,
toothbrush
the
head,
head of the toothbrush, not the toothbrush itself. If
the
for the
motor.
manual, yes, exactly, because it's quite expensive anyway. You don't
Right.
want to throw money away. And if you have a manual toothbrush, what you can do, you can change it every 30 days. That's my best recommendation because by that time the bristle will be open. We're going to have a episode about that to go deeper about
Yeah.
different type of toothbrush, when the toothbrush need to be changed. But at least I advise to change it every 30 days if you use a manual toothbrush because it's wet, it's moist.
It's
You
dirty.
brush your tongue with it,
Got
most
bacteria
likely
all over.
bacteria, exactly, bacteria
It's like an
will need
old
to be done
dirty
away.
sponge after a while. Like, when you clean your dishes with the sponge and after a while it starts to smell moldy and gross and it's time to throw it away and get a new one. Same concept with the toothbrush. Like, you got to don't hold on to it. You got to throw it away, get a new one.
Exactly, exactly.
Hudson recommends every 30 days. I like to make it easy for my patients to remember every season. So it's about to be summer, throw away your toothbrush, get your summer toothbrush. In the fall, get your fall toothbrush. Winter, winter toothbrush. Spring, spring toothbrush. A lot of people can remember that.
Yes, I agree with you. My preference is like for the bacteria. It's depend how, and it's important on how you take care of your toothbrush.
Hmm.
And we will dive when we're going to talk specifically about toothbrush, about brushing. We're going to talk more about it, how to properly take care of your toothbrush
Right.
and all of that. Before we go into that saying about the brushing, we want to make sure our audience know it's not only one just brushing for brushing. They have different technique of brushing. There is one that called Stillman brushing method, right? We will dive in it when we're going to do the brushing, but at least for now, I want our audience to know about that technique, know about different technique or method that is there. We have Stillman brushing method. Is it good for patients that have gingivitis? Right? I'm not going to dive in it much. We will go back. Don't worry about it. We will talk about it. The other one is called Bass brushing method, right? They call it circular method as well. It's the same pretty much about the 45-degree angle that we'll be talking. We'll tell you more about it. And that technique is good for patients that have periodontitis. That's mean disease of the periodontium that have gum, periodontal ligament, and all of that. When you go to the dentist, they tell you, oh, you have periodontitis or early periodontitis. And then they say, oh, you start losing bone, bacteria live underneath your gum, and you start losing bone. That's periodontitis. When the gingivitis and we have your gum inflammation, you have bleeding, that gingivitis. And you have another method that called charter brushing method. The charter brushing method, it is best for orthodontic braces, or you can brush directly to it. We will talk about it. We will talk about it soon. And we have the circular brushing method. This is the most common method that people use. Like when you go to the dentist, they tell you, you do like rotate the toothbrush, and with lateral position, you start in the right side. I'm sure that's the one that we're going to do in our break. And that technique, that's the one that they start teaching us since we were kids, because most people know it. And you take your time, each teeth or each tooth will be clean, or the group of teeth will be clean, right? Make sure everything is clean. And one of the things that's very important, even with brushing, like we said, is to brush your tongue. That's part of brushing, right, Jennifer?
I
Brushing your
recommend
tongue.
using a tongue scraper, but we can get to that later.
Yes, I agree with you. The tongue stripper is good, especially for some people that have thrush. Thrush is like people that have the white thing in their tongue or hairy tongue and all of that. Like, I just said my patient, the brush itself, the back of it have like a tongue scraper in it to help you. Or if not, just brush your tongue. Make sure you always clean your tongue.
So we're going to do later on, we're going to do an experiment where we're going to brush our tongues to see how clean they get. And then we're going to use a tongue scraper to see how clean they get. I do get a lot of patients that are like, well, I just brush my tongue. Just think about what the name of the tool is that you're using. You're using a toothbrush. It's not good for the tongue. I mean, it can work, but it's not an effective tool. You use a
Yes.
tongue scraper is meant for the tongue. It's a highly effective tool. Using a toothbrush for the tongue is better than nothing, but a tongue scraper is where it's at.
Yes, I agree with you 100%. It's better you do something than nothing. The best thing to do is to have a tongue scraper for the tongue.
Correct.
I agree 100%. Get those bacteria out.
Correct.
Just flush out.
So, just kind of going back to our basic items. So, basically, the two basic items you should have in your dental hygiene kit is some type of toothbrush and some type of floss. So, we've touched base on toothbrushes. Get a manual toothbrush, get an electric toothbrush, some type of brush. It doesn't matter the brand or the kind. But also get some floss. You can use string floss, you can use floss picks. String floss is the better of the two because you have more control with your fingers. But some people have a hard time getting their fingers all the way in their mouths. They might have dexterity issues. They might have their hands might be
Arthritis.
really large. It's just hard to get in there. Floss pick is a good alternative. A floss pick is just as good. It's easy,
I-
convenient. People in general will definitely floss more with a floss pick.
if
So
it is
those
not
are my
my first, it's not my first pick, because I always say to my patients, the pick, you will need different pick, because especially when you have a lot of plaque, It's like
Uh-huh.
you're putting those bacteria, even your rinse like in different in interdental space. Interdental space mean between the teeth, different teeth. With the strings, right?
Mm-hmm.
You can roll it and get a fresh floss.
Right.
But like we say, it's better you do something than do
The
nothing.
nothing, yes.
But
And
make
also
sure when you use the pick that you rinse it out at least,
I
at
tell the
least
patients to just like do a quad and then throw it away and then get another one. It just depends on, like if it looks nasty, toss it out. It's okay to use more than one in your mouth. Like it's okay to use 10 in your mouth if you really need to. So, floss pick, you can throw it away and get a new one
my
if you really need it.
my technique is to use the arm length. It's use the arm length of of the string.
Yeah.
It's anyway. There's a technique to use it because you can cut your gum.
Yeah, we're going to
Yeah,
go over
we're
that.
going to go over that
We're gonna
later.
go over everything in like more detail. So, but
Yeah.
those are my two recommendations for basic oral hygiene needs. The two tools that you need 100%. You need a brush and you need floss. Period.
Yes, definitely 100%, 100%.
Very good. Okay. So we talked about our oral hygiene basics. Did you have any fun dental facts or dental trivia for us now?
Yes, I think so. I think so. A one oh man, I cannot wait. It's quite interesting. It's quite interesting. I'm going to ask you some questions.
You're going to ask me some
Can,
questions.
yes, pretty much for dental facts. Can you tell me the state that have the best dental care
Oh, okay.
in
Repeat what you
United?
said.
Can you tell me the state that have the best dental care in
Oh, the
America?
state that has the best dental care in America.
Yes.
I think you kind of hit me with this one earlier. Wyoming. No, Wisconsin. Is that the best? Wisconsin?
The best dental care. Sorry to say that. I don't think it's Connecticut.
Connecticut.
Okay, the next five. Which state have the least cavities?
Which state has the least cavity?
Cavities. People that have least cavities.
Um, I always think it's someplace
It's a
fancy like New
W.
York or California because they really care about their teeth.
It starts with a W.
It's Wisconsin.
You got it. You get it.
Love Wisconsin. Wisconsin.
Wisconsin. I,
Wisconsin.
my people from Wisconsin.
Yeah.
Less cavities. Go, peep.
I'm proud of
Go, my
them.
peep.
Yay. I have lots
Good
of friends
job.
in Wisconsin. I lived in Wisconsin for 2 years, so yay,
Nice,
Wisconsin!
nice. I guess you contribute to that fact.
It was me. I helped them do that.
That's good. That's good. That's good. Okay. The next one, sadly, which state have the most cavities?
Which state has the most cavities?
Yes.
So I feel like it's one of the poorer states. So Mississippi, Alabama, Ohio, maybe.
You're not too far, but
Which is it? What's the answer?
I'm letting you guess.
Um, Tennessee. I know it's not Georgia.
It's you have Texas is one of them.
Oh, Texas. Uh-huh.
Yes. However, Montana has one of the highest percentage adult with poor fair oral health condition.
With what oral health condition?
Yes, poor or fair oral health condition.
Poor or fair oral health condition
Yes,
in
that's been
Montana,
way.
you said?
I think we might need to move to Montana to those
Right.
areas. Yes, but
Luscious landscapes. I'll go there.
yes, yeah. My people from Montana, if you are listening to us, that's okay. You will be okay. You will be okay.
Invite us over.
Definitely, definitely. Okay, Jennifer, what do you have for us to at least? I know you have some fun things. I'm ready. Let's
Okay.
roll.
So another thing that I think is really important, a lot of things that I hear from the patients when it comes to managing their oral health at home, brushing and flossing, they always say, I don't have time. I don't have time. And you have to make time, you have to prioritize it. And I think this is the perfect opportunity for us and our audience to pause, go grab your toothbrush. I have my toothbrush here. Hudson, do you have your toothbrush?
Oh yes, it's right here.
Our audience members, please take 5 seconds, pause this podcast, run, go get your toothbrush, and then come back. I'll give you 5 seconds. Five, four, three, two, one. Okay, get your toothbrush,
Let's
and we're
go.
we're gonna have a brushing break. So we're gonna just work it in here. We're gonna be accountable for brushing. We're gonna take accountability, and we're gonna make sure we get it in today. So 2 minutes, 2 minutes for brushing. Here we go.
And you're willing to tell us what to do.
Okay, perfect. So just pick a side, pick a spot. Just start there. I like to start on the bottom right. I'm doing modified mask method. I'm brushing the gums a little bit, angling my
Mhm.
toothbrush down a little
We
bit.
have to massage it.
Gently
Mhm.
massage and brush the gums. It should kind of like tickle. Get in there. I go all the way around. You should be on the left side now. Little bitty circles. Also, don't
Mhm.
brush too hard. If you're holding your toothbrush with the full fist, you're brushing too hard. Hold your
You're
toothbrush with
killing. You're killing the teeth and
you're
the gum.
brushing your enamel away. So just hold your toothbrush with your fingertips.
Congrats. Hmm.
Imagine a wand or a paintbrush. Okay, we brush the outside bottom teeth. Get the inside. Really brush in there. Get in the nooks and crannies.
Well, yes, it's
Yeah,
important, right?
yeah, get it in there. I like to go back and forth. Like if I feel like I've missed a spot, you can go back. It takes 2 seconds to go back. Get the top, the biting surface of the bottom teeth. Get in
Yeah.
there.
Mm-hmm.
Go back.
Take them out.
Uh huh. Jump to the top teeth. We're ready for our top teeth now. Start on the outside.
Mm-hmm.
Little circles. Make sure you're getting that gum line. Move on around.
Mm-hmm.
Get the other side.
Mm-hmm.
Brush the inside of the top teeth, the tongue side. Get in there. Mm. Also, change your mindset about brushing. A lot of people think, oh, I hate doing it. I think to myself, I'm massaging my teeth. I'm massaging my gums. It feels so
Mm-hmm.
good. Get that biting surface. Get in there. Mm. Okay. And it's been 2 minutes. And we didn't even need toothpaste. We didn't need water. My teeth feel clean. Do your teeth feel clean?
Oh yes, 100%. But with the
100.
toothpaste, it will be
It'll be a little
best.
better.
Yeah.
But when push comes to shove, if all you have is a toothbrush, no toothpaste, you can still get in there and do what you need to do. So be accountable to yourself and love yourself and make sure that you're taking time out of your day to spend 2 minutes with a toothbrush in your mouth.
Yes. Definitely. Nice and clean.
Nice and clean.
And one thing that I want to mention as well, we are talking about the about brushing. One thing I always say to my patient, you floss. We're going to go through the entire sequence how to properly take care of your mouth, right? Or of your teeth. It's you floss, you brush, and then if you have a mouthwash, it can be whatever it is
Mm-hmm.
that is good. It's not like a for mouthwash. It's not like everything. Like for example, just an example. I'm not endorsing any product. Let's say Listerine.
Mm-hmm. That's a
I'm just
popular brand.
everyone Listerine.
So
Yeah, a popular
yeah,
brand.
it's popular.
So yeah, and then no, it doesn't work like that. It's not all mouthwash that's
Hmm.
good for everyone.
Right.
There's some people that might need something that have more fluoride in it. There's someone that might need something that good for gingivitis, or
No
someone can
alcohol.
exactly no alcohol. That's my favorite. No alcohol a mouthwash, or you can use a pretty much natural type, or they call it bio or bio, a mouthwash as well. It's your
Hmm.
preference, and if they do the work, just go with it.
Right.
Or you have to listen to your provider. Your provider will help you to choose the best type of mouthwash or toothpaste that can help you as well.
Yeah. Yeah.
Yeah, definitely. I'm pretty much how I was excited about our podcast today, and I cannot wait for the next episode. Thank you so much, Jennifer. And you have the rest for you can text our audience. And I'm so excited for this journey together.
I'm really excited too. I've had a great time on the first episode. We have so much to cover. Like, we're never going to run out of topics. There's so much to talk about. There's so many people to talk to. I'm really excited. I'm just excited about everything in general. So um, sky is the limit. We're
Definitely.
going all the way up.
Definitely, definitely. Because we have to take care of the mouth. Because what? Mouth
Mouth
matters.
matters.
We'll see you next time to the next in the next episode, guys. Thank you so much.
Bye.
Bye. That's a wrap for today's episode of Math Matters. Thank you so much for joining us on our journey to better oral health.
If you enjoyed our conversation, don't forget to subscribe so you never miss an episode. If you have any questions, comments, or suggestions, feel free to reach out to us on social media or email us at mouthmatterspodcast@gmail.com.
Keep in touch and send us your feedback.
Until next time, keep smiling and remember your mouth matters.